Good day, this is Kat Dukeli, and today we shall discuss Introduction to Synthesis of Research. At the end of the session, the learner is expected to understand the needs for synthesis of research, identify key features of particular types of reviews, know the characteristics and components of systematic reviews and meta-analysis, and to understand the essential steps in performing a systematic review and meta-analysis. What is synthesis of research? Research synthesis is the integration of existing knowledge and research finding pertinent to an issue. The aim of synthesis is to increase the generalizability and applicability of those findings and to develop new knowledge through the process of integration. As a background, the advent of evidence-based practice in the early 1990s has brought clinicians to increasingly rely on healthcare literature in their decision-making. Synthesized summaries of all evidence within a particular domain would be required in addition to evidence from primary studies if clinicians were to make truly informed decisions within a typical consultation. However, the review article of the time seemed ill-equipped to meet such a challenge. Hence, medical review articles of the pre-EBP era were generally unsystematic, lacked formal statistical methods to derive best estimates of treatment effects from the available information. These tended to reach conclusions that were biased and wrong. So, the Cochrane Collaboration is an international, not-for-profit organization that aims to help people make well-informed decisions about healthcare by preparing, maintaining, and promoting the accessibility of systematic reviews of the effects of healthcare interventions. And this was started by the Effective Care in Pregnancy and Childbirth Systematic Review. So the systematic review of the randomized trials of obstetric practice that is presented in this book is a new achievement. It represents a real milestone in the history of randomized trials and in the evaluation of care, and I hope it will be widely copied by other medical specialties. So this was a foreword by Archie Cochrane. So the Cochrane Collaboration is the work of Chalmers and colleagues in the area of pregnancy and childbirth, inspired the vision to extend this to the rest of healthcare. In 1992, the UK Cochrane Centre in Oxford, UK was established. In 1993, the Cochrane Collaboration was founded. In the evolution of synthesis, gathering research and summarizing the best of what remains captures the essence of the science of systematic reviews. And the need to synthesize research evidence has been recognized for well over 2 centuries. It was not until the 20th century that researchers began to develop explicit methods for this form of research. The rise of the review. So, to view, inspect, or examine a second time or again, many review types are now in existence. Variation in the degree of process and rigor is evident in the structure and in the methodology of articles. More professions, healthcare in particular, have adopted and adapted the systematic review method. The model of the systematic review of randomized controlled trials has limited potential in certain settings. Thus, it necessitated the identification of a greater range of review. Here is a review of the review types. So first, we have the critical review, and aims to demonstrate writer has extensively researched literature and critically evaluated its quality. It goes beyond mere description to include degree of analysis and conceptual innovation. Typically, it results in hypothesis or model. Next, we have literature review. It's a generic term of published materials that provide examination of recent or current literature. It can cover a wide range of subjects at various levels of completeness and comprehensiveness. It may include already the research findings. Mapping review or systemic map, it maps out and categorizes existing literature from which to commission further reviews or primary research by identifying gaps in research literature. Meta-analysis, it's a technique that statistically combines the results of quantitative studies to provide a more precise effect of the results. Usually, it makes use of the forest plot. In mixed studies review or mixed methods review, this refers to any combination of methods where one significant component is a literature review, which is usually a systematic review. Within a review context, it refers to a combination of review approaches. For example, combining quantitative with qualitative research or outcome with process studies. Next, we have the overview, and it's a generic term which means summary of the medical literature that attempts to survey the literature and describe the characteristics of the literature. Next, we have qualitative systematic review or qualitative evidence synthesis. This method for integrating or comparing the findings from qualitative studies and looks for themes or constructs that lie in or across individual qualitative studies. The rapid review is an assessment of what is already known about a policy or practice issue by using systematic review methods to search and critically appraise existing research. A scoping review is a preliminary assessment of potential size and scope of available research literature. It aims to identify nature and extent of research evidence, usually including ongoing research. A state-of-the-art review tends to address more current matters in contrast to other combined retrospective and current approaches. It may offer new perspectives on issues or point out area for further research. The systematized review attempts to include elements of systematic reviews while stopping short of systematic review, typically conducted as postgraduate student assignments. Umbrella review specifically refers to review compiling evidence from multiple reviews into one accessible and usable document. It focuses on broad condition or problem for which there are competing interventions and highlight reviews that address these interventions and the results. Now we go to systematic review. It seeks to systematically search for, appraise, and synthesize research evidence, often adhering to guidelines on the conduct of a review. Systematic search and review combines strengths of critical review with a comprehensive search process. It typically addresses broad questions to produce best evidence synthesis. So here are the most important types of reviews. The literature review summarizes a topic that is broad in scope. Example, cancer treatment. It is usually qualitative and may use sources that are biased, but does not define what types of studies will be included because it looks at everything. Next, we have the systematic review, and it answers a question specific to a clinical question. Example, the population intervention, comparator, and outcome. Vitamin C or chemotherapy, a better cancer treatment in patients over the age of 40. So it defines a specific search strategy, lists what will be included, excluded in articles selected, and can include a meta-analysis within the review, but it's not necessarily. Lastly, the meta-analysis looks at studies from a systematic review. The purpose is to combine similar studies and pulse data to get a statistically significant results. It is important because statistical analysis may overturn results of smaller clinical trials. So you know this triangle and is the hierarchy of evidence. So at the basis, we have the weaker studies. So these are background information and expert opinion, followed by case-controlled studies, and followed by observational studies such as the cohort studies. Next, we have the experimental studies, which are the randomized controlled trials, followed by the critically appraised topics and articles, and the systematic reviews are the strongest hierarchy of evidence of medical journals. Now we go to systematic review and meta-analysis. Systematic reviews and meta-analysis are at the top of the evidence hierarchy as seen earlier. So when assessing the effectiveness of health interventions. So it is important sources of synthesized information for decision makers, consumers, clinicians, funders, payers, regulators, and researchers. The main reasons for undertaking systematic reviews and meta-analysis is to minimize bias and to maximize data by collating all the relevant available evidence on a particular. So here is an example of the website of the Cochrane collection of systematic reviews and meta-analysis. You just have to type your PICO here in the search and it will search for any available systematic review and meta-analysis on your topic. So there is a Cochrane handbook for doing systematic reviews of interventions. So this is a guide for those who will make a systematic review and a meta-analysis, and it is available online. So what is a systematic review? It is a review of the evidence on a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant primary research and to extract and analyze data from the studies that are included in the review. Again, it makes use of weaker studies and it does a total review of those that are included, which has the same population, exposure in intervention, comparator, or outcome as your PECO of interest. So what authors do is to get all the available literature and funnel them out, extract the data from the studies, assess the quality of the studies, and combine the data. They discuss and make a conclusion based on the combined data and write the systematic review for dissemination. So how do systematic reviews figure in there? Systematic reviews are essential tools in synthesizing available scientific information, increasing the validity of the conclusions of primary studies, and identifying areas for future research. They are also indispensable for the practice of evidence-based medicine and the medical decision-making processes. It establishes whether scientific findings are consistent and can be generalized across populations, settings, and treatment variations, or whether findings vary significantly by particular subsets. A systematic review involves, as a unit, individual studies rather than individual trial participants as seen in randomized controlled trials and observational studies. So it collates all evidence that fits pre-specified eligibility criteria in answering a specific research question and uses explicit systematic methods to minimize bias. So one must have a set of objectives with predefined eligibility criteria, explicit methodology that can be reproduced, assessment of the validity of included studies, and systematic presentation and synthesis of characteristics and findings. Here are key characteristics of a systematic review. It should be a clearly defined question with inclusion and exclusion criteria. It must be rigorous and systematic search of the literature must have been done. It must have critical appraisal of all included studies. And the data extraction and management is to remove the bias from all these studies. It contains analysis and interpretation of results, usually through the forest plot, and it reports it for publication. So the Cochrane Handbook for Systematic Reviews of Intervention is very important when you are considering to do a systematic review or a meta-analysis. So what is the difference between systematic versus narrative review? So narrative review is also known as a traditional review and is often written by an expert in a particular field. So qualitative studies of a sample of the literature may be included, and selection of evidence may be lined with the reviewer's professional or personal opinion. Articles may be selected in order to support also the reviewer's position, and reviewer uses an informal approach to selection of studies and presentation of results. So here is a overview of the difference of a narrative and a systematic review. So before doing any reviews, assess this beforehand. Are there enough studies to support a systematic review of your question? Are there existing systematic reviews? Why would you still perform one if there is one already? Is it appropriate to do a systematic review and a meta-analysis? Is there enough literature published on the topic to warrant a review? Is there a body of evidence available to analyze, or does more primary research need to be done? Can your research question be answered by a systematic review? Do you have a protocol outlining the review plan? Do you have a team of experts that will help you? If the answer is yes, then go ahead, do your systematic review. But before anything else, formulate the review question. It should be focused, sensible, well-framed question and includes the population, exposure or intervention, the comparison or control, or the outcomes. The methodology must always be randomized controlled trials in systematic reviews of intervention. So these are the inclusion criteria of those studies that you will be including in your systematic review. In formulating the question, so in reviews, it is the question that guides many components of the review process. So the eligibility criteria, the studies to be searched, the data collected from included studies, the presentation of findings. So the general steps in preparing a systematic review will include the following. So we must state the objectives of review, specify eligibility criteria, conduct the search, usually a systematic search. We must apply eligibility criteria. We must compare the characteristics of each study and assess the quality and the risk of bias. We must analyze results of studies, combine statistically if appropriate. We must conduct alternative analysis as needed and formulate conclusions from our findings. Lastly, we have to state the implications for clinical practice and research. So in summary, the deluge of medical information necessitates the filtering and the synthesis of valid, accurate, and precise estimates of effect. There are many different types of synthesis and reviews, and the systematic review and meta-analysis collates and reports available evidence using a clear, explicit methodology and scientific